This is what gum disease looks like, and this is an antibiotic pill. Most patients think that you can just take a pill and magically all of your gum disease goes away. But that is not the case. It is not that simple. In dentistry, it doesn't work the same in medicine where you can just take a pill and your problems go away. In case you're new to the channel, I'm just a dentist and my patients ask me this question all the time about gum disease. Can I just take antibiotics to clear up gum disease? And the short answer is no. Antibiotics alone isn't going to do anything for your gum disease. Antibiotics can help in conjunction with seeing a dentist, getting a deep cleaning, getting a regular cleaning every 6 months, but alone is not gonna do what you think it is. It's actually not gonna do a whole lot for you, and actually can be very dangerous for you because you could produce what's called antibiotic resistant bacteria in your body, which is bad, affects your entire body. And the main reason antibiotics don't do what you think they're gonna do for you is the fact that they don't do anything alone. They need to be in conjunction with a cleaning. So antibiotics don't address the root problem, which is actually the bone and bacteria that is being affected underneath your gums. So basically every gum has a periodontal pocket. The deeper the pocket, the more likely you've lost bone, and it just becomes exponentially more and more difficult to actually clean your gums, because if you're brushing your teeth and you're flossing your teeth and you have a 6mm pocket, it's almost impossible for you at home to get your bristles down there 6mm. I'll tell you, it's near impossible and people just cannot do it on their own. Now, there are 3 stages of gum disease, and gum disease, by the way, is very, very common in the United States. There's estimates upwards of over 50% of adults in the United States have some form of gum disease. Now, just simply taking antibiotics is not going to help when you're in the stage of gingivitis, which is the first stage that people get in this progression of gum disease. What is gingivitis? It is basically your gums are getting really, really irritated because they're tired of the bacteria that is accumulating with not only plaque, but tartar. Tartar is a buildup, or calculus is another word for this, and it is a hard substance that builds up over time from the accumulation of plaque. If you don't get rid of the plaque, now your gums are going to bleed, they're going to be inflamed, you're going to get pockets, and calculus is going to form, and it is just going to get very, very difficult for you at home to maintain this, and that's why you need a dentist or a periodontist to actually fix this for you. If you have mild, moderate, or advanced periodontal disease, now we can use antibiotics because antibiotics will actually be the kicker to actually help things get cleared up. And what I mean by this is we're actually going to go down there and we're going to do deep cleaning with a periodontal instrument, a hand instrument, a mechanized instrument that sprays water. We call that a cavitron. It's actually going to go below your gums and we're going to mechanically kick all that bacteria out. We're going to clean all the surfaces, get rid of the bacteria on the surface of the tooth, in the pocket, outside the pocket, and we're going to use 2 different types of antibiotics. One is a topical antibiotic, the other is a systemic. A topical antibiotic can be a gel. It can also be a little pellet. We have this little gun that we kind of shoot a pellet down in your gums. It sounds worse than it is. It doesn't actually hurt that bad. And that is locally going to eat up all that bacteria and make it easy for your body to fight that. Now, in advanced stages, they may use lasers. Periodontists may use advanced technology to actually clean this out. And they're going to give you a pill of antibiotics, and they're actually going to use an antimicrobial rinse. We're basically going to throw everything we have at this very serious problem, because a lot of patients don't realize how serious this progression is. You have gingivitis, it progresses, you don't take it serious, you've got calculus, you've got these calculus bridges, and now it's to the point where your teeth are wiggly and they are hurting and you need advanced help, you need a specialist to treat this. So we're gonna give you the pill of antibiotics to actually go systemically. These are the pills that you swallow and you take, and they go inside your entire body, but they're gonna clean you from the inside out of the bacteria, and then the periodontist and the gum specialist is gonna actually clean the outside. So in advanced cases, antibiotics can actually do a lot for you, but alone they will do absolutely nothing for you. So if you do think you have gum disease, your gums are swollen, you're flossing your gums and they're getting red, you have blood, you have a little bit of blood on your floss, or you're noticing your gums are bleeding on their own, please go see a dentist, because that dentist needs to address this and get on this right away. You need to get a cleaning, you need to get maybe some antibiotics to go with that if it's more advanced, and you need to get on that ASAP because this can be very serious. That's all I have for this video. Go ahead and subscribe down to the channel and leave comments below if you have had gum disease. And there should be a lot of you commenting, because gum disease is actually pretty common in the United States and all over the world. It's actually a pretty common thing for people to have. So not a big deal if you have it, but don't think that antibiotics are going to clear it up all on its own. Thanks again for watching. Watch some of these other videos and I'll see you in the next video.